the first time that you hear the news that you have cancer, it's always hard. It's not an easy thing for someone to tell you that you've been diagnosed with cancer. So when you get told for the second time, when you get a recurrence, your first recurrence, second recurrence, wherever you are in that recurrence process, the mental load is a lot. My name is Amanda. I was diagnosed with LGSOC when I was 26 years old. So it's a very, very heavy mental load when you are in your recurrence because you're balancing where you've been versus where you are now versus where you think you might go in the future. When I got diagnosed with LGSOC, they said, let's just take a precaution, look inside, see what's going on. And they let me know the news that I did have tumors and that I was diagnosed with LGSOC. So my surgery was to get my tumor out and get any of the tumors that were kind of surrounding in that area. And then I completed chemotherapy and I was good for about a year. And then I had some more symptoms starting to come out. And then unfortunately, it was a recurrence. And so for me, that was really devastating. When I got diagnosed with the recurrence of LGSOC, they talked to me a little bit about hormone therapy. So I hadn't heard of hormone therapy prior to my recurrence. I did have a lot of joint pain at the beginning. I had a lot of fatigue with it. There are things, like hot flashes and stuff that still occur every so often. I was hoping, honestly, for something like a targeted therapy. I had heard about targeted therapies before, things, if you have a specific mutation or something like that. There's lots of resources to help. Thankfully, I think the first resource is always trying to talk with your doctor first. I think they're going to be the first step that you should take. As far as mental health resources, therapy has been phenomenal for me, so I highly recommend people have a therapist or get in touch with a social worker or nurse navigator or something or someone who can really talk with you. And you need a person that you can talk to where you can be your 100% honest, full self and really say, this is exactly what I'm feeling. And I think for me, it's been 4 years. It's taken a lot of work. It's taken a lot of therapy. It's taken a lot of talking and mindset changes. And it is really challenging. I won't lie about how challenging it is to get to the point where I am today. And I'm really thankful to be where I am today based on all of that work.